Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd like to talk about a comment about cough and inflammation on the lungs. So I'll show you the comment real quick. So this one, the first one here. So, afternoon, doctor. I have a non-stop cough for 14 years. And this year I went to get an x-ray of the chest and they found out that I have inflammation on my lung. Now, what can I do? Now, obviously, this is very vague comment. So I'm not your doctor. I'm not providing medical advice through this channel. I'm just trying to kind of give you some perspective from the other side, from the medical side, what we would generally think about doing in these situations. So hopefully that's helpful. And I do urge you to always go see your own healthcare provider if you have any medical problems, any concerns, because they're going to be the best people to advise you in your specific situation. Now, obviously, everyone is different, everyone's conditions are different, and symptoms and so on. So that being said, just talking about the cough, talking about the inflammation on the lungs, what would this mean? Now, just let's talk about inflammation on the lung. This is basically a term that's been used a lot. Now, what is inflammation? Now, inflammation just means that if we were to dissect it slightly more, would be that you have a tissue in which there is infiltration of inflammatory cells. There may be a little bit of extra fluid that gathers there in that inflamed, swollen area. So that is usually caused sometimes by infection. It can be caused by some autoimmune conditions. It can be caused by allergies. It can be caused by a lot of things. So it's a super vague term when we use the term inflammation. It doesn't refer to anything specific. So it doesn't automatically mean infection or autoimmune disease or, something worse. And I do notice that this comment was put on a video that I made about lung cancer. So again, it's probably people being worried about these terms that they sometimes hear in consultations and they wonder what that may mean. And that leads you to searching the internet, maybe coming across this video or other materials and trying to figure it all out. Now, inflammation on the lungs, it's important to note that, that could be in the airways, so in the little tubes that lead towards the deeper parts of the lungs, or it could be within the lung tissue itself. So this is where we're thinking about the inflammation. Now, if it's an x-ray, I do wonder whether that was just part of a wider workup in this situation for a cough that wasn't going away for 14 years, as the person rightfully said. So if you have a cough that's been going on for a long time, usually the first step is you go to a doctor. Maybe it's your family doctor, your general practitioner. They might try and figure out what's going on with simple things. They might think that maybe you've got asthma, maybe you've got chronic bronchitis, maybe you used to smoke for a lot of the years. So these could all be causes for having a chronic cough. But then you would probably be sent off for some investigations. Now, usually when we're trying to do an initial investigation for the lungs, we would probably refer you for a chest x-ray. And that's absolutely reasonable, but that is just a picture of the lungs. It's a two-dimensional picture. It doesn't give us extremely detailed information, but it can rule out some big things. So for instance, if you've got, something acute going on, so if you've got an acute pneumonia, or if you've got signs that, this is, again, depending on where you are in the world, this can change. So this is the differential diagnosis. So the types of diagnosis that could cause a cough are very wide. So someone might have tuberculosis, someone might have bronchiectasis, someone might have asthma, someone might have COPD, emphysema, so on. So there's a lot of conditions that can have certain signs that we can pick up on a chest x-ray, but usually it requires some further investigations down the line just to try to narrow it down further. But that's usually a very good, right investigation for the first things. Now, obviously, if the x-ray is abnormal, then we probably would go down a further route. So depending on the health system where you are in the world, it could be your family doctor, your general practitioner that might refer you on to a pulmonologist or a respiratory physician. So then you might have further tests from there on. You could have potentially a chest CT scan. So this is a cross-sectional imaging, which is more detailed. It's a 3D picture of the lung tissue and the chest, basically. And then that could sometimes give us an indication as to whether there are areas of inflammation, let's say, as it was mentioned here, within the tissue of the lungs, or if the lung tissue is actually clear, the spongy tissue of the lung is actually clear, maybe it's within the airways. Maybe the airways appear thickened. Or maybe the history that you've presented to your doctor suggests that you could have potentially asthma. So things like that. So we are trying to figure out what's going on, in a logical fashion as much as possible. But generally, when you are investigating a cough, what you would normally need to do is first probably see a doctor. If you've had a cough that's been going on for months and months, I think it's a good idea to check what that is about. Normally, when you have a virus, a chest infection, something like that, so you can't have an ongoing residual cough, as we call it, for about maybe up to 2 months. But if it's beyond 2 months and the cough's not improving, it's not getting any better or getting any worse, you've got other symptoms going on that are worrying you, you should probably see a doctor. And then what we would do normally, we would probably take a detailed history of what's been happening with you. We might ask you about other medications that you might be on, because some medications can sometimes give you an ongoing cough as a side effect. So that's something that we would look into. So for example, this would be ACE inhibitors. So this is for a fairly frequent cause of a cough. So people might have this for high blood pressure. They might have a medication such as ramipril or something like that. Medications that end in pril, and these can be a cause of cough in some people, and they can just be replaced with another alternative medication and the cough tends to improve. But again, I wouldn't advise you to change any medications just because you've got a cough. So please talk to your doctor, because you might need that medication for a very good reason. So again, it's something that you need to discuss with your doctor on a case-by-case basis. Then we might ask you about other medical problems you've had in the past. So for instance, I don't know, if you've had a lot of episodes of pneumonia, whether we might need to look into that a little bit further. You might need further imaging. We might, ask you about all kinds of other things that have happened sometimes a long time ago. We might ask you about family history. So this is where the history really plays a really big part into trying to get to the right diagnosis. Now, after that's done, and let's say we've done the x-ray, like in this case, in this comment, if the x-ray is abnormal, we would generally, as a respiratory investigation, if there are some spots that we see on the x-ray, we might want to get those investigated further, because the x-ray sometimes isn't enough to give us that three-dimensional picture of the lung. So the CT scan, the computed tomography scan, is basically when you're lying on a table and we go through this donut-shaped machine. So this gives us cross-sections of the lungs, as is slices, for lack of a better word. And we look at the lung tissue and we can see what those spots on the x-ray may represent and whether that's something to worry about. So the CT scan can be sometimes requested, but generally we don't request scans in absolutely everyone because it's generally unnecessary. So your doctor can advise you whether you would need that or not. There are some instances though when a chest CT scan, and I've talked about this previously, might be requested if you are, for instance, having a high risk of having lung cancer. So this is generally in people who have smoked for many, many years. They're usually above the age of 55. So, that's a population that might have a higher risk of lung cancer. So trying to get that as early as possible, try to identify that as early as possible. This could be something that people might send you invite you to have one of these CT scans. It's a low-dose CT scan. Sometimes we do this fairly frequently, but it depends on your individual risk. Again, your doctor is the best person to advise. So I'm not trying to be wishy-washy by this, but it's just very, very difficult to come up with the right diagnosis for the right person just on very limited information. So that's why your doctor tends to kind of follow a very standardized or logical approach based on your situation. Other things that might be requested. So if, for instance, your history suggests that you might have asthma, say you having episodes of cough and chest tightness that come and go, you've been having this for a while, maybe it's related to something you're allergic to, then they might actually either diagnose you with asthma because it's fitting the picture perfectly, or they might send you to do some breathing tests. So these would be lung function tests or pulmonary function tests, for example, a spirometry. So you blow into a machine and we measure the volumes of air that you can breathe in and out and how quickly you can do that. And based on that, we might get an indication that there might be an obstruction potentially in the airways. Or maybe a restriction, or maybe you're not filling up your lungs as much as you can. So that can also give us a lot of information. Sometimes we do the spirometry test by asking you to blow into the machine. Then you take an inhaler, such as a Ventolin, a blue inhaler, and then we do the spirometry test again, maybe 20, 30 minutes after. And if you're having a significant improvement in your values, in your lung volumes, that may suggest that there is a reversible component of obstruction in the airways, something that's blocking the airways that could be caused by spasm of the little muscles in the airway, maybe inflammation, because we're coming back to this inflammation bit in the comment. So as you can see, it depends a lot on your initial symptoms. So for instance, if the cough is dry, if the cough is productive, you're bringing up a lot of phlegm, How long has it been going for? Is it triggered by something? Is it variable? Do you have good days, bad days? So all of these things sort of play a role in trying to put you down the right path. So I think what I'm trying to get at with this video is not to necessarily give you one answer that will fit all situations, because I think that's impossible, but just to encourage you to try and see a physician, a doctor. Depending on where you are in the world, you might have different ways of accessing this health system. But if you have a cough that's been bothering you for months and months, I would suggest that it's probably a good idea to see a doctor. And then just to give you a few warning signs. So some things to look out for. I think that would be helpful at the end. So if you've been having a cough for many months, but there are some other things that are popping up, I think that requires a more urgent consultation. So for instance, if you've been also losing a lot of weight at the same time, that probably requires looking into it a bit further, especially if the weight loss was unintentional. So your clothes don't fit you anymore, you're coughing and coughing, probably that requires a more rapid evaluation of what might be going on. And again, going into it with an open mind. It could be an infection, chronic infection, could be other things that are a bit more sinister, such as cancer, but it's important to catch these things earlier because the options are always better. Then obviously if there's any abnormal bleeding, so again, if you're coughing up blood or anything like that, probably you should go and check with your doctor and see what that might be about. If you have significant chest pain that comes with the cough as well, probably it's another reason to go and check what's that about. Crushing chest pain, stabbing chest pain, really painful, associated with that cough that's not going away. Again, you might need to check with your doctor fairly urgently to see what's going on. If you're feeling unwell and you're having a cough, you're really, really unwell. Of course, you're fainting, you're, sweating, you're really not well. You should probably go see someone. The sooner the better. So these are just a few things to mention. Obviously, think about other things as well that could be, warning signs. So if you're having digestive issues at the same time, you've had a change in your bowel habits, you're losing weight, things like that. If you're having any other signs that are worrying, you should probably go and check with your doctor. I don't think there is such a thing as, a doctor being unhappy that you saw them too early. So this may sound a little bit silly, but I think sometimes just going for an opinion and having your doctor check you out and say that, I can't find anything wrong, that's probably better. It's more reassuring for you. It allows the doctor to make sure that you're not missing anything, that we're not missing anything big that might require intervention. So probably going earlier rather than later is better. So I'm sorry if this video was a little bit all over the place, but I tried to give you a little bit of a perspective and encouragement to actually go and check your health out if you're having any worries. And hopefully that was encouraging. And I think most doctors that you will see will be fairly encouraging to try and help you and figure out what's going on. All the best and good health.